Dr. Song, am I a good candidate for this health study that you're getting ready to do?
We are looking for individuals who have chronic medical conditions, serious chronic medical conditions, who are willing to make lifestyle changes so that they can reverse such medical conditions. We want to be able to modify their diets and their lifestyles and really be able to document the changes that they'll go through by following the program.
Are you looking for people with only lifestyle diseases, or are you looking for anyone that's sick?
This program is so comprehensive that we can pretty much reverse any medical, psychological, as well as spiritual conditions that people are suffering from.
What are some of the key components of this health study that you're doing?
Really, the key components of this program is the lifestyle choices that they make through diet, exercise, and rest, and many more.
Can I just choose some of the things to follow, or do I need to follow everything?
The strength of this program really comes from the holistic approach that we have. When people follow the program more closely as intended, then they'll see the greatest benefits. So program is powerful enough that it can improve many conditions, but if you really want to see a complete reversal of disease, that it is important to follow as close to the program as possible.
If you've been helping people all along to reverse these diseases, why now are you doing a clinical health study?
We really wanted to do a clinical study to demonstrate conclusively that these programs work. We wanted to demonstrate that it's not just anecdotal incidents where we see improvement, but that we can take anybody's medical condition, and through these holistic approaches that we can make dramatic changes and dramatic improvements.
Why did you choose 24 days?
Most of the medical conditions require some time to improve, but we found that when we make modifications in their lifestyles, that we can see the most changes by the third week. If we can do it beyond 3 weeks, we can demonstrate pretty conclusively that we can make dramatic improvements with people's health.
What types of diseases and health issues can this comprehensive program reverse?
We've seen people with hair losses, we've seen people with chronic liver disease, with Parkinson's and such, where they were really, really suffering daily. But through the lifestyle changes, they were to make great recoveries. And the closer they follow the program, the greater the changes that you'll see.
Can I return to my former lifestyle after my blood work gets clean and I'm all healthy again?
We say lifestyle changes because it's really meant to be more permanent. If we reverse back to our old self, then most likely the disease will return. So therefore, these changes are meant to be more permanent, so that we can stay healthy for the rest of our lives.
How long does it take to see the health changes in my life?
From our experience, we've seen changes that takes place within a few days to a few weeks. It really depends on how strongly the individual adhere to the program. If they make complete changes, you may see quick response. If you make minor changes, you may see it may take longer to see response to the therapy. However, most of the diseases can show reversal by second and third week of the program.
Say I'm 60 years old. Following this program, what condition will I be in after, say, a month?
We've seen individuals after months of therapy that they state that they feel like they're back in their 20s and 30s. And so they're going to see great changes as long as they stay close to the program. Really, these are not our program, but it's a program that God intended for us to follow so that we can be a demonstration to the world that God is who He is, that He is all-powerful, and that He is able to keep us healthy.
Even people in the medical world, they're finding now a plant-based diet is much better, where the Bible, it started with a plant-based diet. Is there any correlation there? I mean, now science is actually proving that the Bible was correct. Is there a correlation?
Absolutely. People tend to want to ignore that fact, but Many studies are beginning to show that plant-based diet is truly the proper diet for humanity, and that when we, as God's creature, consume the original diet, then we are just much healthier, and that we have more vitality in us. But as soon as we deviate away from that original diet, that's when we begin to see a lot of these chronic diseases creep up, and it creates a lifelong dependence on medications.
I understand that you're going to be doing a documentary on this, documenting for the general public, as well as doing the clinical study. Why did you decide to do a documentary?
We wanted to spread the good news through the media, where it's much more readily visible, so that people can learn about these holistic approaches, and that they can make changes in their lives.
So what about diabetes? What is the shortest time that you've seen someone reversed?
Diabetes is unique is because we're able to reverse it so quickly that we have to really caution the patients not to take their medication as intended. So the quickest that we've seen somebody get off the medication was within 3 days. But we have to be extremely careful that we don't bottom out their sugar level, because this therapy is so effective.
Is cancer something that this program will affect?
The key component of fighting cancer is your immune system. And if we can revitalize your immune system, then you have the best chance of fighting and overcoming the cancer. So therefore, this program is probably the best in restoring your immune system, so that you have the best fighting chance to overcome the cancer.
What if I have been given up on by the medical society? In other words, they can't do anything for me. Would something help following this?
We are looking for people in that condition, because they are the best candidates, because they are willing to do all that it takes. And to my experience, we've seen greater changes in those people than people who have common diseases with common medical therapies.
Individuals that have been basically sent home, they don't have any more hope as far as the medical profession considers them. What can you do for them?
Really, these are the individuals that we are looking for, because I believe that we can make the greatest impact on their lives, because they are so much more willing to make complete changes in their lives. We've seen people who have chronic diseases that they're really suffering day by day. When we gave the lifestyle choices and instructions, and when they made complete turnaround with their lifestyle choices, we've seen great improvement in their medical condition.
What if you can't even walk? What if you are bedridden and you've been sent home?
That doesn't matter, because we've seen people who couldn't even walk for a few steps because they were out of breath, and yet with the lifestyle changes, they were able to walk miles within even a few weeks, and they were able to get their mobilities back. So it doesn't matter whether you're bedbound or you're immobile, we can help you.
Is there any disease that this wouldn't help?
Out of all the patients that we saw, we haven't come across any patients that we weren't able to help.